Today's COVID report, it's hard to say that this is good news, but it's 1,972 new cases of the coronavirus. Remember, Mondays are typically our lowest days. And this is a lot of cases for the day of the week that's supposed to be the lowest day. But this is lower today's than our last two Mondays before it. And just about every other day I've stood up here and given this report. It's the highest Monday, Tuesday, Wednesday, you pick. This is one of the first times that I can remember that our number is lower than multiple previous weeks. It does bring our total number of cases to 202,592. That's since March the 6th. Our positivity rate today is at 9.60%. So that's just a little bit below last week's average. 1,700 individuals in the hospital fighting COVID, 410 in the ICU, 210 on a ventilator. We're going to work, because I got a question last week, which was a good question, on seeing how we can break out those numbers regionally and how they compare to overall capacity. Capacity we're going to have to base on beds because personnel, which we're worried about more staffing in the hospital, is a lot tougher for us to gather that information and engage it. If we're able to do that in the future, we'll endeavor to. New cases by county: Jefferson 343, Fayette 171, Warren 66, McCracken 55, Boone 54, Kenton 52, Whitley County 48, Woodford 44, Bullitt 43, Hardin 37, Campbell 34, Pulaski 32, and then 30 in Boyle, Hart, and Madison. The others can be found at kycovid19.ky.gov, but it's everywhere, and we got to treat it like it's everywhere. We've also lost 10 additional Kentuckians today, at least one in their 60s, and what we're seeing recently is more people in that age group or below. So remember, this thing doesn't just come for those that are older, and it doesn't just come for people with serious health conditions. I can't tell you how many times that somebody said, well, they had a comorbidity, and I asked what it was, and it was hypertension. That's high blood pressure, right? How many of you out there have hypertension? Or sometimes it's diabetes. Well, we have at least over 600,000 Kentuckians with diabetes. So remember, when people talk about other health conditions, there are things a whole lot of us have. So those that we've lost today include an 89-year-old man from Allen County, a 71-year-old man from Bullock County, an 89-year-old woman from Graves, a 77-year-old woman from Greenup, a 92-year-old woman from Jessamine, an 87-year-old man from Johnson, and an 86-year-old man from Johnson County, 76-year-old man from Marshall County, and two Pike County residents, an 81-year-old man and a 67-year-old woman. So let's make sure, again, that we ring those bells at 10 a.m. and we light our homes and businesses up green. So the wreath that we hung today in honor of those 2,000 lost Kentuckians has green lights built in. So there's going to be an extra green light right there over the door of the Capitol, shining for these 10 lost Kentuckians. And now the 2,082 that we've lost in this COVID pandemic, remembering them. Green is the color of compassion. It shows that we care about their families, and we care significantly about this loss. It's also the color of renewal. We know that these 10 individuals and all 2,000 plus are just leaving their earthly body, and that they are moving to a better place. And renewal also reminds us that there's a better day ahead. We just got to fight for it. Long-term care facilities, 324 new residents testing positive, 268 new staff members testing positive, 87 new deaths attributable to long-term care population. This, everybody look at it, this shows you exactly why we have to vaccinate those in long-term care as quickly as possible. Incredibly important that we do so.